Welcome back. Most of the time, an achy stomach isn't anything serious, but when your pain persists or it's joined by other symptoms, it can quickly become an emergency. We want to talk about appendicitis today and the importance of having an early diagnosis. So we want to bring in Dr. Dana Bittner with True Women's Health because this is something that you have experienced firsthand just in the past few days.
Well, I'm laughing because today I guess I'm Jane, right?
Yeah.
So last week I was here on Wednesday, and on Thursday I had my appendix out.
Wow.
So, the reason I want to talk about this is that everyone deserves to have the experience that I had, right? 6 days later, yesterday I was back at work,
Wow.
right? So everyone deserves this. And, appendicitis has a very clear history if people know and if doctors listen.
Yeah.
So again, so important that you know and that you have doctors that listen.
Yeah.
And I had all of that.
Well, you look great. We're so glad that everything went well with you and that you're back on your feet so quickly. What are the signs? What did you notice yourself?
So on, Tuesday, Wednesday, I was just tired. Like I usually go home and I'm still doing stuff, but I wanted to go to bed. I was tired. And Wednesday I had like belly pain around my belly button, which is where it tends to start. And I had a light dinner, but I felt like I had Thanksgiving. Like I just felt so full and uncomfortable. In the middle of the night, I had a little low-grade fever. And then in the morning I was driving to work and I just didn't feel good, but I went over a bump and I felt the pain go down to my right side.
Okay.
And so that's classic, that the pain stays around your belly button 12 to 24 hours and then it migrates to where the appendix lives, which is right in your right lower quadrant. And I knew immediately what I had. And I'm thinking, what 59-year-old woman has appendicitis? This tends to be something that happens to women and men in their 20s, not 59, but what are you going to do? So I knew what I had, so I had a couple of patients I had to see, and then I called my husband. We went to Right Care Clinic. I had a CAT scan. I called a dear colleague and friend who's a great surgeon, and I was in the operating room by 4 p.m. and I was home by 7.
Wow.
So he was probably only in my belly 20 minutes. So I have 3 little laparoscopic incisions and it went great. So bottom line is the experience was perfect. I did great. I'm doing great. I'll be fine. But all women deserve this experience.
Yeah, well, catching it early, I mean, obviously it's very treatable, but it can quickly become an emergency situation if it's not caught early enough, right?
Correct. So we know that the longer it goes on, the risk of rupture goes up by like 10% per day. And often women aren't diagnosed early. So again, it's really important to know that you need to be heard, because if that were to rupture, it's a collection of infection, bacteria. So if it ruptures, that bacteria can go everywhere. And it can cause serious infection. It can cause long-term effects like on fertility if scar tissue happens. It can cause sepsis, prolonged antibiotics, you're in the hospital a long time. So again, it's really important to be heard and to be treated early.
Absolutely. So you're Jane, but you also have a Jane story to share.
I do. So the stories have been flooding in, and I heard yesterday about a woman who was in an ER, sent home 4 times for what they thought was constipation. And again, constipation doesn't have a low-grade fever, it doesn't have a white count on the CBC, like there are signs. Anyways, she was sent home 4 times with constipation. Her appendix ruptured. And here, this woman is a marathon runner. And she went septic. She was super sick in the hospital for 2 weeks in rehab. And she now has long-term health consequences from this. So it didn't have to happen.
Right.
So again, it's so important that people listen to their body.
Yeah, and know the signs. What's your takeaway tip for this?
Takeaway tip is trust yourself. To stay healthy, know your body, ask for help, make sure that you are listened to, and please know about appendicitis and be able to act fast.
Yeah, and advocate for yourself, of course. We're so glad that you know the signs. I mean, if anyone's going to know the signs, you are going to know the signs, Dr. Bittner. So we're glad that you are well. We're glad you're here with us. Thank you so much for your time. We'll be right back after this.